Hello, good evening. I am so excited to be here with you this evening as we are going to dive into why dentistry needs to understand OMT. This is a non negotiable. This is something that absolutely has to be in the evolution of dentistry's next step. It was 100 years ago before orthodontics became all the powerhouse that it became as a specialty. It was the primary, unique specialty. It has been over a century that this thing has been going, and it's time that it gets the recognition it deserves. So, as always, I like to welcome you in and, always say, send me something in the chat. Just let me know that you can see me, that you can hear me, and that I'm not talking out into the void. Hey, Roxanne. All right. Now, I'm always saying this. I'm your Myo best friend. I'm Carice. I'm a hygienist and I don't practice clinically anymore. I only do myofunctional therapy and I come to you live every single week trying to talk about all the different aspects of myofunctional therapy and reaching it from every end of the spectrum, whether you're brand new and you have no idea, you're just starting to learn what myo is, or you're an active therapist that's been practicing. But either way, you don't want to miss a thing. So subscribe. If you're watching me on YouTube, make sure you subscribe to the channel. You'll be the first to get the notifications. I go live sporadically. It's not at the same time all the time. And so you'll be the first to know because you will pop up for you and you'll get that alert. So turn on those notifications, comment, that expands the reach. That way we can create this wonderful echo chamber of excellence. That's what we want. That's what we want to exemplify, not the echo chamber of, you know, mediocrity. We don't want that. Okay. Don't forget, if you're on LinkedIn, connect with me. Happy to connect with you anytime. All right. Let's jump in. Okay. Uh, Quick aside, my birthday is coming up. It's a big one. It's the 4-0. And so for that one, I'm actually probably going to be doing a really special birthday sale one day only, and that's Monday, 3/31. So if you've been interested in any way, shape, or form in getting into a myofunctional therapy course, probably not Myopathway because what I'm thinking is since it's a big one, I'm probably going to do 40% off just across the board, but it won't be for Myopathway. Unfortunately, I'm sorry, I'll do something different for Myopathway. But for everything else, all the Myo launch products, there's a whole wealth of things that I offer, but you'll be able to save somewhere up to $3,000 on all of my stuff. So looking forward to that. Stay on the lookout for that. If you are not connected with me on LinkedIn, you probably won't see it. If you're not connected with me on Facebook or in the Myo community on Facebook, you probably won't see the sale. So make sure you get connected. Join the Myo community on Facebook and or connect with me on LinkedIn. All right. Dentistry. Dentistry is an interesting profession. It is quite the beast in and of itself. It is something upon which I think there's very little understanding. One, of what it is that's actually going on within the dental world. I think I love these types of graphics where it's like what everybody else thinks you do versus what you really do, and like the sense of monotony or regret that so many dental professionals have. So, dental clinicians, there are a lot of dentists and a lot of hygienists who are always talking about how they wish they did something different, selected a different career. They didn't know it was going to be all this. And meanwhile, everybody else thinks it's just absolutely fabulous or completely horrendous. But what I will say is that dentistry hasn't changed very much. I think the biggest advancement that's really happened in dentistry, and I mean, everybody could say AI, you could say all this other stuff, but literally anybody anywhere is using AI. Sue's grandmother in, I don't know who Sue is, I'm just making up a name, but Sue's grandmother in the middle of nowhere, Ohio, has ChatGPT and is using it. So it's not revolutionary that's happening in dentistry. The biggest shift and the change that they have had is maybe digitalizing the x-rays and so forth. But other than that, dentistry really has been very stagnant. It's very, very slow to evolve. Medicine is doing all types of things and implementing various treatments and protocols and all this sort of thing. And dentistry is doing the same old traditional restorative drill and fill. As interesting as it gets is airway or sleep or implants. Maybe you do implants and then, woo, it's so much excitement. I will say that for dentistry to evolve, we have to start thinking outside of the box. We have to start looking at things a little differently because right now, dentistry is, on the downward spiral. And I don't think that that's where any of us want it to go. Nobody who got into dentistry got into it for all the chaos, the stress, and the confusion that the industry has really brought to us. So, mentioned AI very earlier. I asked AI, what's going on in dentistry right now? And AI answered, and it wasn't saying anything very positive. But what it did say really did highlight what we're talking about tonight, how there needs to be a shift and we have to start doing things differently. When we're looking at insurance and we're looking at reimbursement rates and how everything is declining, a third of dentists who were asked in a recent survey have reported that their insurance reimbursement rates have decreased at least 7 to 15% decrease of insurance reimbursement rates. Now, when I went to go look it up from another perspective, the insurance industry is like, no, no, we've been paying more gradually over the years. And in the last couple of decades, we've increased reimbursement rates and, periodically made things better for the dentists who are a part of our plan. So it's interesting that that's a conflicting thought. It's not a it could be a marketing tactic, but it's not a generalized accepted fact that insurance rates have either declined or been stagnant or increased. But what we do know is that there are two big, big challenges is that the cost of overhead, so the margins on profits for dental practices have decreased for sure. Everything's going up. Wages are going up, equipment's going up, rent is going up, space is going up. Like, even if you own your building, your property taxes have increased. You have a lot more that you have to pay for and you have to account for, on top of the fact that sometimes just keeping a fully staffed practice is very, very difficult. It's incredibly difficult. So people are struggling to acquire and to retain good team. But it's your lucky day because consumerism is on the rise. And what does that mean? Good things and bad things. So part of the good is that people are buying all sorts of corrective or cosmetic procedures, which creates a lot of great opportunities. And we'll talk about how Myo fits into all of that. But with consumerism on the rise, it does also mean that people are more cautious. People already have a negative outlook on dentistry, what it is, how we, operate, whether or not it's sleazy, whether or not people are just trying to, oversell things and are being unethical or unscrupulous and whatever. But people even more so are now being like, look, every penny that I spend, I need to know where it goes and why. Why do I need this procedure? Can this cavity wait? No, because you're telling me that my tooth is going to be bombed out. All right, great. I'm going to get a second opinion. And if my second opinion is a more conservative doctor, well, now I'm probably never coming back to your practice because I feel like you trying to scam me or there was something shady or underhanded that was going on, right? So we want to make sure that we're actually getting the upper hand. And if you're getting the upper hand, you need a lot more in your back pocket than what you're going to do with restorative dentistry. That's where the Maya really comes in. That's where a lot of dentistry doesn't really go to, which is thinking outside the box. Stop doing the traditional things. When you do things that are extraordinary, you get extraordinary outcomes. Not always. There are people who don't always do really well, like people who jump into sleep or airway and think that they can take one course and, oh, yay, everything's going to change. That's not the way that that works. You have to have a really well rounded, fully fledged, thought out approach. If you don't have an approach, you just have a course, you're going to fail. Okay. But it's important that we start thinking outside the box for even traditional dentistry, because not everybody wants to be in sleep and airway. Nobody cares about tongue ties, or not many people care about tongue ties, and less than 1% of dentistry is actually practicing anything related to sleep and airway. So, how do we, as people who are interested in myofunctional therapy, expanding its reach, take advantage of the opportunities that are present with corrective and cosmetic procedures? Well, yay! I'm super excited to share with you that there's more than one way to do Myo, just like there was more than one purpose for a lot of different things. I think we all know that the blue pill that got very prominently big for helping men, and you know which blue pill I'm talking about, that blue pill was really for cardiac problems and really focused on doing things within that world. Ozempic that everybody's talking about, or any sort of semaglutides, those were diabetic medications. It just has a different purpose, and like people are leaning into the different purpose and loving it. It's like Play-Doh. I don't know if any of you are ever watching and like you get random fun facts about me when you pay attention to these live streams, but if any of you have ever watched like the Food on History Channel, Food That Built America, the mega brands that built America, or the toys that built America, I love those shows. It's absolutely great. You learn so much fabulous stuff. They tell a story in the best ways. And they had a really great story about Play-Doh. Now, Play-Doh actually was originated early 1900s. Now, early 1900s, it actually wasn't even a thing for kids and like dough for them to play with. It was for cleaning wallpaper. Wallpaper used to get like a residue and it used to be really difficult for people to clean. So, what did housewives need back then? Some way to clean their wall. So, they get this wonderful thick dough and they're able to actually get things off of the wall, which is wonderful, but you know, it wasn't selling that well. The company was actually about to dissolve, but there was a relative who was a teacher who actually gave some of that compound to the children, or and they struggled with the current clay that they had. If you look at actual like molding and modeling clay, it's tough to work with. You really got to get your hands in there. You got to like, it's very difficult. For small hands, it's not easy. And so, wouldn't the kids be better off if they were using something that had a better consistency, like this wall cleaner? And so it was a combination of a very innovative idea and a new approach to something that was designed for something entirely different. Like, yes, Myo was designed in order to help with, you know, airway and craniofacial development and tooth stability, orthodontic retention and changes, but there's so much more that we can do with it. It can rebrand itself within dentistry to have a bigger life and a bigger purpose, in the same way that Play-Doh reshaped itself, in the same way that blue pill has a whole different understanding, in the same way that when I talk about Wegovy or Ozempic, you're not thinking about a diabetic. You're thinking about your favorite celebrity. So just consider the fact that if we start to think outside the box, we can find these purposes all throughout. So we know that oral dysfunction is a contributing factor for a lot of what's going on inside our patient's mouth, for a lot of oral health decline. If there is oral dysfunction, oral facial dysfunction, pharyngeal dysfunction, it is going to impact our patients' systemic wellness, obviously, but it's definitely going to lead to a decline in the oral health that we are all looking for as dental practitioners. So, when we think about that, I think we need to broaden our horizons to how else oral dysfunction can really, on a localized scale, instead of looking at it as like this mass overwhelming, yes, we've got all of this dysfunction, and how are we supposed to identify it? And we have to look at this and that, and then where do tongue ties come into play? Like, forget everything you think you know about myofunctional therapy, and I want you to just dumb it down into sections, okay? Because there's so many possibilities. I'm going to talk to you about six tonight, and from those six, I'm sure we can come up with like 26 more. But I want you to just really hone in on these six and the possibilities that these six do place for us as a profession being able to integrate smoothly into dentistry. So, we're going to talk about prosto and denture success, which I know goes along with prosto, but it's also its own individual thing in a way. And we'll get into both of those. Oral maxillofacial surgery, aesthetics. Aesthetics is so underutilized. There's a wonderful course for both oral surgery outcomes and aesthetics in Myo Launch. Very affordable courses like that deep dive with their own little exercises and different ways that you can really utilize and implement these things if you are a myofunctional therapist. TMD, which I could talk for days about that. If you will be in Dallas this July for RDH Under One Roof, you'll get to hear me talk about it for 2 hours. It's going to be a really fun interactive workshop, and I'm going to live play out how you can utilize OMT in the dental office for your patients doing TMD, kind of like what I do in my Airway Hygienist Academy course. And I think that it's something that's absolutely fabulous and incredible for all clinicians, all dental clinicians to actually know. And then perio. Perio is my passion project. Many of you who know me know that I will stand on that soapbox and scream to the entire universe, like, why we're not doing myofunctional therapy for all perio patients. I think we're doing an incredible substandard of service, but that's neither here nor there. Let's dive into prosto, okay? I really like this graphic. It just felt like they were staring down into the depths of my soul, and I guess that's what happens when you're in the chair. It looks like people are staring down into the depths of your soul. So you're going to see this picture pop up multiple times today, okay? And if at any point in time I lose you or you have questions, drop them in the chat, okay? Just hang on with me. All right, so with prosto, I think we all know that bone responds to loading. We know that because of the osteoblast and osteoclast relationship, right? Bone breaks down, bone builds up. Like, when there is compression and the bone is impacted, there is going to be a breakdown or a rebuild of the bone. Everybody can universally accept that, right? Like, that's an evidence based truth. Osteoblast and osteoclast exist for this purpose. Tooth eruption is something that we can definitely use as a mechanism of understanding or driving home that point, in addition to bony defects, because the whole fact of super eruption and tooth coming to meet a tooth when teeth have space, it wants to load, it wants to have that occlusal relationship. So it's seeking out its partner, right? When there is no partner. And so we're winding up with a super eruption in spaces where, let's say, there's no tooth that is opposing, then it starts to drop down. And bony defects, because as we do all of that grinding, clenching, all of the bruxing, we know that vertical bony defects do occur. So when these bony defects occur, what is it stemming from? Bone loading, right? All of the pressure of the loading on the bone. So, with that being said, what does this all have to do with prosthodontics? I mean, very obviously, there's a lot in prosto of full mouth reconstructions where there's all on fours or all on six or all these big things, and they're doing a lot of occlusal rehabilitation. So when that's happening, I want you to think critically from the lens of a myofunctional therapist. Where can we help, and where can we sell our services as a option for supporting all of those types of procedures and goals? Well, we help to reduce or eliminate parafunctional orofacial habits. We help in balancing the soft tissue pressures, both intra and extra oral, and we establish proper tongue, jaw, lip resting posture. Okay, so proper posture of the oral function is ultimately going to lead to the patient adapting quicker to a new prosthetic and maintaining better long-term function with that. Now, yes, this sounds a lot like something that would be the same argument, and in a lot of ways it is the same argument for our denture cases, okay? And it is, but with dentures, we know that when we have edentulous patients, a loss of their teeth is going to mean a direct loss of bone. And so it's not that the bone is responding to loading in a same way, because when you have all on fours, you're still going to be loading on the forces of those implants. And so we can balance out those structures and help to better retain and keep the bone around there. However, when there's no teeth, everything changes. Things start to sink in, things start to fall. You lose your facial muscle strength and engagement, the appearance, everything starts to sag. Like, we're losing a lot, and that changes the function. And you have people, and it doesn't matter how many times they come in, and you can reline and you can reseed and you can whatever your dentures, but at some point, we all have those patients who come in who are like, yeah, I don't even eat with these. I just wear them when I go out because, it's uncomfortable otherwise. Like, they just don't use it in function, in daily life function. They struggle to talk with it. They struggle to eat with it. They struggle to just live, be, and sustain themselves with this thing in. And so I think it's incredibly important that we start looking at dentures and what happens in the physical sense of how people are changing and how the body is changing and how it's adapting to this edentulous environment. And now we're going to start looking at the remediation of oral facial dysfunction, because now when we start to eliminate oral facial compensations, any sort of asymmetry, overdevelopment, underdevelopment of the oral facial region and all of the muscles within, we're going to have a better, comfortable environment where we're balancing out, yes, the intra and the extra oral pressures of those muscles, but we're able to retain, and they get less. They're able to function better, so they get less of those sore spots. And then that's going to increase their satisfaction in that function. So now they're able to use their dentures in a more functional way. When I talk about dental sleep medicine, and that's like one of my new passion projects, perio was my big soapbox. My second next soapbox is dental sleep medicine, because we don't do enough collaborating as myofunctional therapists with dental sleep medicine, and dental sleep medicine doesn't inherently promote myofunctional therapy. They see us as a competition, not necessarily as complementary. And we are complementary in the same way that you can adapt better to the use and the satisfaction in use of an oral appliance or an mandibular advancement device is the same way that you would adapt to wearing a new set of dentures. Now, is it different because one might be edentulous and the other one, still has a good number and set of teeth? Absolutely. However, the concepts around how we support are the same. We're dealing with the muscles that are really around all of these structures and that are able to help us to support them. Okay, good. Hopefully I didn't lose anybody. We're getting close to halfway through. Okay, oral maxillofacial surgery. When we talk about oral maxillofacial surgery, a lot of people are thinking very unilaterally. You might be thinking like MMA surgery, maxillomandibular advancement surgery, and it's not just that. We can help with a lot of different surgeries and a lot of different surgical outcomes. I think it's important that we remember that we got here to where they needed oral maxillofacial surgery for some purpose. So whether there was a trauma, and now we're in restoration of the oral facial structure and we're trying to save and resolve. And so now there might be a whole plate instead of where the bone was. A bone may have gotten shattered in a car accident. Now there's a whole plate. How do you adapt to chewing, to functional tasks post operatively, to your new set of function where you don't have maybe the same muscular capabilities? When we have oral facial recovery and things that Becca Clark talks about a lot, and things that I've been super excited like diving into, like working more with oral cancer patients and people who have had large chunks of muscle and mass removed and are now trying to functionally recover. How did we get here? We lost a bit of function. We lost some muscle. We lost some nerve and structure. How do we restore that? It's not just by surgery, because an alteration or a surgical changing of the form of the area doesn't inherently on its own alter function. And when we think about medicine as a profession, medicine is always advocating for collaboration. Medicine is working with each other. They don't consider themselves competition. It's not okay, well, you could do surgery or you can do PT, and I'm probably not going to recommend PT because I'd rather you do the surgery. They're like, no, 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 no. You need both. Okay. So I'm going to write you a script. You need physical therapy. You have to do the physical therapy for some. There are several surgeries that you have to do the physical therapy prior before you can even get the surgery. And I wish dentistry would evolve towards that, where it's like you have to work with a functional specialist before we do this surgery so that you're maximizing all of your function. It makes it easier for you to rehabilitate afterwards if you have a already like improve some of your function. Yes, there are long wait and recovery times, but you started out where you were if it wasn't a traumatic event with some level of dysfunction. So remediating that prior is going to help you adjust back sooner to proper function. It'll even help you with some of the healing and recovery. Like if you have a tongue thrust and that's how you're swallowing, you're not going to like swallowing like that post MMA. It's not going to feel good. And you do a lot of swallowing of soft foods and liquids. You have a very, very soft diet. And so you're swallowing, and imagine how often you would be thrusting out towards the teeth if we're just waiting for you to recover. You've got enough going on in that area. Everything has been surgically like modified, moved. There's inflammation. Wouldn't it be better if you already had a proper swallowing pattern prior, oral phase swallowing pattern prior to then recover, right? So think about all of the oral maxillofacial surgery patients you may come across clinically in dentistry. So many opportunities for you to get pre-surgical preparedness in, for you to recommend post-surgical recovery, for all of that to ultimately help improve for the patient their muscle function and adaptation post-surgery. Now they're getting that function, and it goes along complementary to whatever changes are happening structurally or aesthetically. That's going to help to reduce the risk of them relapsing and the surgery not having the best outcomes, and ensure the long-term stability of any sort of corrections that were made to the jaw, because bones respond to loading and you don't want to be producing extra load on this new maxilla and mandibular advancement that you've had. You want it to function properly. That way you can create that stability over time. Okay. All right. Aesthetics. Aesthetics is a wonderful up and coming use of myofunctional therapy. I don't think enough people are using it. Similar principles to what you would do with prosthetic, similar principles to what you would do with dentures. We're working on the oral facial musculature, but you're working on the oral facial musculature in a way that you're enhancing beauty. And beauty is muscle deep. It's not skin deep, it's muscle deep. All those muscles support the skin, they support the layers of the skin. And so the stronger muscles are actually preventing and helping to combat those wrinkles, the sagging of the skin, and improving the vascularity of it so that you get better color in your skin as well. And so you're able to help on a deeper level. If any of you have seen Keeping Up with the Kardashians, and when they did face yoga, face yoga is still a thing. It's still a very big thing. It's much bigger than myofunctional therapy. And myofunctional therapy has an actual purpose that's beyond just aesthetics. Like, it has a functional purpose. But face yoga is still a very, very big deal. There are many apps that have, done a lot of exercises that we do in myofunctional therapy to help people to achieve more aesthetic outcomes. But when we're thinking about this for dentistry, where does it fit in? You're like, what does that have to do with dentistry? There's plenty of dental spas that are mixed in with aesthetics. Okay, so they already have aesthetic treatments. Some of them have an esthetician in the practice. Or if you're doing cosmetic procedures, if you're doing cosmetic procedures that are making the teeth look absolutely beautiful, but like there's facial asymmetry or there's some crookedness, or they're going to go next to their plastic surgeon because they want to have some implants put in or more fillers or Botox, we could do some of that stuff just with myofunctional therapy alone can get you way farther for significantly less, at least, if not more, than 75% less than what you would pay for plastic surgery. So it makes sense that this is complementary for any sort of aesthetic outcomes that you want to achieve within a dental practice, because it's going to remediate any asymmetries, any overdevelopment, any underdevelopment, any facial muscle dysfunction. Like, it's going to help to build up all of that aesthetic promising changes that you want. And that's going to help with your cosmetic treatments and your dental spa services. Okay. TMD. So a lot of people talk about TMD and they talk about the muscles, and I think everybody knows it's all about the muscles. We don't do anything as far as myofunctional therapy if there is anything structurally wrong with the joint itself, with the bone itself. If the bone is very worn, if there is any sort of arthritis in the joint, if there is idiopathic condylar resorption, if there's a number of things, myofunctional therapy isn't going to do very much. What we deal with is the muscles. And so if it's not muscularly involved, or there's not a large contributing factor that is a large contributing factor that is muscular in its source, that's going to be our number one problem. We are going to tackle that immediately, any sort of muscular contributions. A lot of TMD is muscularly involved. Many types of oral dysfunction, including a tongue thrust, will create a retrusive force on the mandible, which will compress the joint. And so the joint will be compressed up into the condyle is going to be compressed up into that hinge every single time that you swallow, a lot of times that you might speak, or if you're doing any sort of dysfunctional para function and you've got lip hooking, or you're doing any sort of thing that's pushing back that mandible, you're compressing the joint. More and more compression, oftentimes we get disc displacement that can occur. When disc displacement occurs, that's where we get clicking and popping from. That's where we get clicking and popping from. So what do? As myofunctional therapists, we are able to remediate a lot of that dysfunction that is happening. So the muscles of mastication might be overactive. They might be engaging in functional tasks that are asymmetric, such as masticating, chewing unilaterally, overdeveloping one side, or they might be bruxers. They might sleep on one side and they might have more pressure on the joint on one end. They might do a lot of shifting of the joint, and we're helping to get them aware of all of these negative habits and how they can appropriately ride on the joint, how they can appropriately open, close, shift, um, excurd, or like forwardly move the mandible. So I'm trying to use fancy words and I don't need fancy words. How they can move the mandible. That way, we're able to establish a new disc, a pseudo disc. The old one starts to resorb, and yay, suddenly, oh, that clicking and popping, it's not there, or it's not as loud, or it's disappearing over time. Yay! Hello for muscular balance and support. Now you've got all the tools that you need to establish a really better harmony so that you're not misusing the joint and leading to further degradation of the joint as time progresses, because any sort of dysfunction is only going to compound over time. It doesn't magically resolve, it compounds. Okay, so you want proper function. Proper function is going to lead to better outcomes in the long term. Perio, save the best for last. Periodontal disease is always going to be my soapbox. We need to talk about perio more and the ways in which biomechanical factors do contribute to periodontal disease in the same way that biochemical factors. They're actually very complementary. So when we think about vertical bony defects, when we think about bones responding to loading, and that alveolar bone really starting to resorb along the vertical dimension where all of the loading is occurring, that's creating additional inflammation in the gingiva as the bone is resorbing, and that creates a wonderful opportunistic space for anaerobic bacteria to just settle all down into. Okay, it's like I wanted to make a analogy to like where you take a very underdeveloped area and you create a more urban area, and I'm forgetting what the word for that is. If you remember it, just throw it in the chat for me. But when you're taking and you're redeveloping an area, it's like you're creating a new environment for those anaerobic bacteria to live, and then that's that biochemical component. So the biomechanics contributed to creating a space for anaerobic bacteria. Now your biochemistry is sitting there. What happens from that point on is that, okay, they're in your chair, you've done your perio charting, you've done your SRP, maybe you've sent them to a periodontist, and possibly they're on perio maintenance now. But you may notice that there's still bone loss. There's additional perio pocketing. Then you're thinking, okay, we got to put something in the sulcus. Like we have to change something else. What's going on with your oral hygiene? I thought we talked about this. And they could be like, we're doing everything. I'm doing all of the things. They could be doing all the things. They could have bought all the tools. They could own the very best electric toothbrush in the world, do all the best steps with manual toothbrushing, have a water flosser, have all sorts of things, be taking oral probiotics. They could be doing all the things, managing only the biochemistry. If we ignore the biomechanics that contribute, well, then, of course, all that's going to happen is they're going to continue to have periodontal disease that is worse and worse and worse. It's just maintaining chronic perio. And so you can do all the scaling and root plating that you want to do. It's not going to get to the root cause. What we need to do is in all the patients that we know have parafunctional habits, and a parafunctional habit is any unintended use of the oral cavity. So mouth breathing is in and of itself a parafunctional habit. Having any sort of thumb sucking, cheek biting, tongue thrust, like all of that, along with bruxism. Because I think when we think parafunctional habits as a field, we only think of bruxism. All of the misuses of the mouth and the oral cavity are parafunctional habits, all of which can be worked on in myofunctional therapy. So why we're not collaborating and throwing it in when every single office in the world is looking for periodontal disease? Everybody is always looking for it in dentistry, but we're never looking for all of the contributing factors. We're only looking at their diet, we're only looking at their habits, their hygiene, and how they're taking care of it. But we're not looking at their function. Oral function is a factor, it's a contributing factor. And so we have to be more on top of that. Okay. I think it's very important. So, Maya, helps to eliminate parafunctional habits because we're going to balance all those soft tissue pressures, establish proper postures, and so forth. But really, what we're doing is we're finally getting stability in all of those people that you know are doing all the things that you told them to do. They want all of those things. It also does help with bone grafting. So any sort of grafting is able to get more stabilization. I've seen that a couple of times, and I think that's actually a really big win. And why we don't collaborate more with perio, I don't know. I don't know. But I really think that we all need to start looking at it from a different lens. And that's really where I'm going to start to round out with is that dentistry as a whole has two choices. It can stay stagnant. It can think that it's revolutionizing and it's got so much innovation. And oh my God, everybody's using AI. AI, I'm going to reserve my opinions on AI. I use AI. I believe in AI. I don't think it's an innovation for dentistry in and of itself. Can it shift and change things? Absolutely. But is AI preventing any sort of periodontal disease? Is AI seeding dentures and keeping more retention? Is AI? No, it's not doing any of the things that we need to do clinically. It is just a tool that we're able to use. Whereas biofunctional therapy is an actual innovative approach to how we resolve problems with our patients that we've never touched before. We've never touched on oral dysfunction as a component or as a factor. There are a lot of people who might, in some offices, and I've heard a lot of this before, and I really think it's sad because it really diminishes the whole field. Who will tell patients, okay, well, just try to breathe through your nose, like close your mouth and just breathe through your nose. Okay, what about the tongue posture? What about the jaw posture? What about any sort of dysfunction? Did you test to see if there was a functional, um, sorry, if there was some dysfunction going on in the orofacial musculature? How is the pharyngeal walls? Can you see everything there? Like, what was their malampati? Do you know anything, or are you just suggesting that everybody just shut their mouth? That is not a clinical approach to resolving oral dysfunction. If you know that mouth breathing is a contributing factor, you can't just tell people to close their mouth. There is no doctor in the world that's just going to be like, oh, yeah, oh, you got a gunshot? Well, like, just don't get shot. And then clearly we won't have this problem ever again. It was great to see you. Bye. That's wild. It's absolutely wild. Okay. This is a big thing that we need to start approaching in a different way. And so we can either evolve as a field, or we can repeat the same mistakes that are leading us in that hole where we have rising costs, rising overhead, and decreased reimbursement rates, more people leaving the field trying to figure out what kind of side gigs they can do, what kind of side hustles, what kind of other opportunities they can get. We've got more consultants than I think we've ever needed in the field. We don't need more of same traditional things. We need true innovation where we can evolve. And so here's the choice. You can adapt to something new and really bring a valuable opportunity to your patients that is an out of pocket cost. And let me tell you, Dr. Miami is not struggling for money, okay? In fact, most of the television shows that you're seeing with reality TV where there are plastic surgeons who are presented, what do you think? They're billing a bunch of insurances for $20,000 mommy makeovers. You can get a mommy facial, okay, at your local dentist. And how much do you think these mommies are paying for it? Of course, they're going to pay out of pocket. Why would they expect their dental insurance or medical insurance to pay for that? Myofunctional therapy has immense value within the dental community and world. And if you don't like the way that things are going right now in the industry, it's time to make a change. Okay? It's time to evolve and innovate and do it for real. I write about this in a lot of different ways, shapes, and forms on LinkedIn. I have a newsletter. It comes out once every 2 weeks. We've had some really fabulous things where I've talked about the comparison between like Nike and the fall of Nike, rise of Adidas, and how all of that happened and how that correlates to innovation within dentistry. More recently, I talked about wrestling. We've also talked about the the checkout lanes, the self checkouts, how everybody thought that was going to take our jobs. It didn't take our jobs. In fact, it's a big fail in the industry. That level of innovation is like AI in dentistry. Like it's not true innovation. It's just slapping something that sounds interesting out there, hoping that it works, and it's not really going to bring any extra income or dollars in that way or sense. And so I think it's incredibly important that we talk about true innovation. If you're not on LinkedIn, then you can't really read it. But I think that if you are on LinkedIn, it's worth your time and it's worth the read. So connect with me on LinkedIn. I'm just under my name, Carice Laguerre. I have the dentist guide to Mayo. If you're like, ooh, this sounds interesting, I need to get this into my dental practice. How can you get it into your dental practice? What are the metrics? What are the numbers? Like, what does this mean for you and your team? Dentist Guide to Mayo explains it all in detail. It's a very great guide. I love it. So you can access that right away. The DSO Guide to People, Patients, and Profits. You see, I'm writing about DSOs because I really think DSOs need to be the next people to innovate this. And so as I'm working my way into consulting in DSOs, I'm really discovering how valuable having a system that really adapts well into a workflow can be for everybody, in all of the different aspects of the practice and how it's helping patients really maximize a lot of their benefits from why they come to the dentist. They're excited to come back after they've had their myofunctional therapy and they're seeing the results and the outcomes. It's very rewarding. And so that is on myomerge.com or Airway Hygienist Academy if you want to work in myo but don't want to leave dentistry. Because as a myofunctional therapist, a lot of RDHs are being persecuted, and people don't even discover this until after they've posted. And this is a big pet peeve of mine. But everybody will go online and they will post, "What course should I take?" And then a bunch of people just pop a course into the chat. And then these people go and they take courses, and then they're like, "Oh no, am I supposed to do this in my state?" Like, no, it's not in any dental state practice act. So I don't understand what the problem is. Like, why nobody told you from the jump that you were supposed to look into all of this stuff prior to getting into the field. People just tell you where you should throw your money away, and then you realize a couple of $1,000s later, like, oh no, this isn't for me. But Airway Hygienist Academy actually gives you plans and a structure and a system upon which you can actually implement this in a dental office as an airway hygienist, not as a myofunctional therapist, because you don't even have the full capacity of myofunctional therapy, but you do have abbreviated programs and treatments and things that you can utilize. And I think that it is probably the smartest way anybody has ever thought of myo going into a dental practice. I'm very passionate about dentistry really adapting this as the next step. I have it white labeled for DSOs, so Airway Hygienist Academy is like a fabulous option. Like, go to airwayhygienistacademy.com if you're a hygienist and you're really looking to take your practice to the next step, okay, and make more money, do better. Oh, I thought I had a slide after that. I guess not. All right. Well, that's the end of that. It was such a pleasure being with you this evening. I look forward to seeing you again next week for more of our chats. If at any point in time you want to talk, let's chat. I talk for free with anybody who wants to talk about Myo and understand where their next step is, what course might be right for you, or how you can better implement this. Schedule a call. And until then, bye, bestie. I'll see you next week.